Dr. Nguyen here, board-certified plastic surgeon. Today, I wanted to discuss the importance of surgical drains. Surgical drains can be used after certain surgeries to help minimize fluid and edema and optimize the surgical outcomes. Surgeries that I typically use drains for include breast reduction, mastopexy, in some cases, brachioplasty, and abdominoplasty. And this is an example of a surgical drain here. When you come out of surgery, you'll see that you'll have these drainage tubes attached to the surgical site, and we call this a little grenade or a bulb. And when it is functioning properly, it will be compressed like this. And it's very important to take good care of your drains in order to make sure everything's functioning well. So this is the drain here in its entirety. Inside the body, you're not going to see this part. It has either holes or channels in order to collect the fluid inside the body. It's going to go along the tubing. I usually place these black dots inside the body so that if they migrate externally, I know how far out they have migrated. And when it's a closed system, meaning inside the body, I'm going to pinch it to simulate that, then the grenade or the bulb will be compressed like this. And if it is compressed, that means that that is suctioning and working well. In order to clean the drain, there are a few steps I wanted to show you. So now I've made this a closed system, and I've added some blue liquid in here to represent what it might be like after surgery. Your liquid is probably not going to be blue, probably some shade of pink or reddish, and it'll transition to a more clear color as the days go by. But this is just so you can see it. It's important to make sure that you strip your drains in order to maintain proper functioning. So if you have alcohol wipes and a glove, it's very important. Imagine this is attached to the skin where it's coming out from the body. Obviously, you don't want to pull it out of the body, that would hurt. So with your non-dominant hand, you're going to pinch and maintain pressure here. With the alcohol wipe here, you go below it and you pinch and you slowly milk it down, making sure the non-dominant hand is pulling it upwards towards your body so it's not yanking out of the body. Then you follow the other hand with the non-dominant hand, maintain pressure here, and continue all the way down the line until you get all the way to the bulb. So usually we do this before we empty the drains to make sure it's working well. In order to empty the drain, you simply pull this little tab here, and then you'd empty the fluid into your collection vessel. You can see how many cc's, there's numbers here, or you might have a small collection vessel with numbers that you can record your drain output. It's important to record your daily outputs and bring that to your post-op visits. For me, I like the drain outputs to be less than 30 cc's for 2 consecutive days. The drains are very important to optimize post-op outcomes in order to make sure the swelling is minimized and the post-op results are visible sooner. So if you don't have alcohol swabs, you can also use hand sanitizer. You need to have a glove though, so you have a slippery surface. You just grab some hand sanitizer, get it all over your fingers, and same thing. Non-dominant hand, hold it, pinch it, prevent it from being pulled out of the body, and you just slide slowly down all the way to the bulb. So whichever way you prefer, both work very well. When you empty your drains, make sure you do so at least 2 times a day, once in the morning and once in the evening. It's best to do them at the same time, so you have a consistent log of the 24-hour output. I have an example of a log here. You can place the date, time, drain 1, 2, or 3, how much comes out, and it's helpful to add the daily output per drain so that you can see when you're approaching that less than 30 per day goal. So So in general, it's very important to maintain great care of your drains and not pull or tug them out of the surgical site, because that would hurt. So take great care of them. I usually leave the drains long enough so you can tuck them into your pockets depending what surgical area you have. Another consideration is when you're in the shower, you can get a lanyard or some sort of necklace. You can slide that through these tabs here and tie it around your neck so that the drains are never hanging and pulling. You don't want to step on them or pull them out on accident. That would not be good.